Hello, my name is Rashad Massoud. I'm the Senior Vice President for University Research Companies Quality and Performance Institute, and I direct the USAID Healthcare Improvement Project. Next week, we are heading to the Salzburg Global Seminar on making healthcare better in low and middle income economies. I'm here with colleagues of mine who are joining us for the Salzburg Global Seminar, and we'd like to share with you some of what is going to be happening at the seminar.
Good morning. My name is Jorge Hermida, and I am the Regional Director of University Research Company's country projects for the Latin American region. We work in 6 country programs there.
Hello, I'm Sodzi-Tettey, Director of Project Fives Alive, which is a project going on in Ghana with the aim of reducing under 5 mortality through quality improvement methods.
My name is Pierre. I'm the Senior Vice President at IHI with responsibility for our work in low and middle income countries.
Hello, I'm Bruce Agins. I'm the Director of the PEPFAR-supported program Health Qual International, designed to build capacity and capability for quality management in resource-limited settings, and the Medical Director of the New York State Department of Health AIDS Institute.
As you know, this is a real opportunity for us to get together for a week with some of the leaders in healthcare improvement from around the world. We have 32 countries joining us with some of the leading organizations in improving healthcare. One of the things that we started discussing as we put this together were what are the issues that we are facing in the global healthcare improvement effort. And I think if we can talk about some of those, that would be a good start for this conversation. So what do you think are some of the key issues that we are facing in this work?
Well, I think first off, we're working in parts of the world where there's very high burden of disease. And I think one of the great opportunities that the quality improvement movement has now is to tackle those key issues. We've been focusing a lot on infectious diseases, the AIDS epidemic, TB and malaria. But I think that there are some other major issues that quality improvement is well suited to tackle. Some of the issues that are coming at us that are going to become more global, I think, like non-communicable diseases and issues of safety. So I think that's our target in terms of trying to reduce the global burden of disease. And the key question really is, can we turn some of the successes that we've had in quality improvement and tackling maternal child health and HIV now to consolidate that work and start tackling some of these other huge issues that are going to have to be dealt with in the coming years.
I think we're at a unique moment as well to take advantage of this opportunity in that there is great attention to public health issues, a basic understanding of quality improvement and an acceptance of it, and also an unusual availability of data now in which to analyze what current issues are as we think about what the priorities are for improvement. And I think we face the challenge of working to build sustainable programs that can be executed in countries to improve care based on what we learn from these data sets.
Rashad, I think that I agree with Pierre and Bruce, but in addition to that, I think that the QI movement in the world is not so young now. I think that the age of demonstrating the effectiveness of QI at small scale has been accomplished. And now I think the challenge ahead is to move towards national scale programs to demonstrate how these successes at small scale can also be large successes at national scale, at a larger scale, and to integrate that large scale improvement movement into the national healthcare systems to end to progressively end QI as something that comes from the outside, from external assistance, and blend it into the actual country health systems with their own resources to make it sustainable. I think that's a challenge ahead.
And no better to talk about this with us other than Sodzi. Perhaps you could tell us about your experience doing this.
For us, it becomes a question of health system strengthening, because you would notice that the ability to demonstrate improvement at a small scale often has been done, in little communities, in little hospitals, and so on and so forth. But the interesting question that confronts us is, at what level does resource limitation become an issue? And then beyond the little improvements that have been demonstrated, are we able to build enough capacity at the national level so that the programs and the improvements that we see are well integrated into the health system structure? If you're working in an environment where you have a doctor to population ratio of 1:80,000, beyond which level do you say that you will need enough mass to be able to see the kind of improvements that you want? So it's time for us, as we think, that to move beyond just application of the methods at the lower levels, to be able to build national capacity, to be able to deliver improvement. Otherwise, we'll be seriously limited.
I agree. I think for me, one of the biggest issues that we're probably facing today is how can we get the systems which we're working with, we're helping to be able to do this independent of the assistance they're receiving, and to be able to carry this into the future on their own. And I think if I were to wish for something, it would be how can we really understand this capacity building that you're talking about, Sodzi. That's a really important part.
I think there's another issue which Sodzi's really been very successful with his program, I think, in Ghana, which is generating the political will to allow a program like this to really flourish. And I think we could learn a lot from what it takes really to get the government on side, or to get the designers of the health system on side, to allow a quality improvement movement in a country to really take off.
And I think we'll have this unique moment at Salzburg, where we'll have representatives from the ministries of health, some of whom are very senior and others who are managers, together with improvement experts to explore these very issues.
Sometimes it's a balance between flexibility in design and redesign, where does a project come in with a very fixed mentality that this is an intervention, this is what we are doing, it cannot be touched, to interfacing with the policymakers and saying that you know your system better, how can we have the potential and opportunity to redesign our intervention to suit you as much as it suits us? And when that conversation takes place, it's often a win-win for everybody.
Yeah, I would agree very much with Bruce that this meeting in Salzburg is going to be a great opportunity, I think, to strengthen a global network of actors who are working in quality improvement in the world. I think that's very much needed. I think that the QI field has flourished a lot, and it's ripe now to strengthen a network of actors globally.
And I've heard both you, Rashad, and Pierre talk about the need for a movement as we roll out improvement work in partnership with ministries. And I think that, as Jorge has also just said, this is really a great time for that to happen.
You know, the whole notion of movement, I think, is a great one. Where is this movement heading? I mean, I'm really interested to see how we think about this, because we know it's not a matter of implementing individual projects. It's not a matter of doing activities. It really is a movement. It's a new way of doing work with a new mindset. Where would you like to see this movement go?
I think that there are many actors, there are many sort of streams of people who need to be involved. And it's not just the ministries, who I think are really important, but they are just one part of a complex set of people who make up, or leaders who make up, the global health movement. And so I think one of our challenges is, one of the things we've not been really good at is evaluating our work, really convincing the academic community that this is a serious endeavor, a serious science that can hold its place with other scientific endeavors. I think that the senior thought leaders, WHO, major funders, are starting to show a lot of interest in the quality improvement movement, and will need to become part of this movement to provide leadership. I think that where we've been successful, I think, is getting the providers involved, the providers who are exposed to quality improvement, and the sort of people that we see at this conference here in Paris are convinced that this is a useful mechanism. But I think that their leaders, the global leaders, the academic community and the funders all need to really be convinced, and it's up to us to convince them. And the best way we can do that is being really rigorous about how we report our work.
And there'll be a session focusing on that at Salzburg, right, which I think is really critical. And I'd like to add also that based on our experiences, we've seen as different countries implement their quality management and quality improvement work, that they do things that are much more innovative than we do at home. And so we learn from them just as much as they're learning from us. And I think I see Salzburg as a beginning of what I hope will be an ongoing exchange and dialogue of interaction between those participating and people who weren't able to come, but will be able to observe the meetings remotely and through internet communications, that we can also then think about how to continue and exchange information and experiences.
And Rashad, I think that the QI global movement has to have as one of its main targets to really reach the mainstream of international organizations where countries are represented, like the WHO, like the regional branches of the World Health Organizations, where ministries of health are part of them, to actually include quality improvement as one of the mainstream activities and approaches. I think that the paradigm continues to be the main one, continues to be one of, biological scientific evidence, clinical scientific evidence, and then telling providers what they should do. And then there's a huge implementation gap that is not being addressed with sufficient energy, and funding is not really being devoted in the amounts that is necessary. So I would like to see the QI global movement having an impact on the mainstream of country programs, government programs, and the agencies where they are represented.
For me, I would like to see the leadership role of Africa emerge going forward. Up until now, the African countries have been presented as some innovation sites. But I think that we have enough outstanding results to be able to show to the rest of the world. When we talk about the burden of the disease being biggest in Africa, it also means that the opportunities for learning are greatest in Africa. And so the learning is rapid. We have places where skilled delivery coverage is about 90%. We have facilities where mortality has been reduced by almost 70%. And in many other places, they are not seeing these kinds of results. So it's really up to Africa now to begin to build its own confidence, to share this learning with the rest of the world. That's what I'm looking forward to.
I think you're right on. And in terms of thinking about the learning agenda for the future, this is consistent with what you're saying, Jorge, that a lot of it is, here's the evidence, let's implement it. We have a gap between what we know and what we do. A lot of it isn't really dependent on new research and finding something new, as much as being able to harness the accomplishments, just like you're saying, Sodzi. If we could understand how people were able to accomplish these great results, make that knowledge available, create the connections between people that would enable them to learn from each other, I think we could come a long way. So in terms of our learning agenda for the future, to me, it's not a pure research agenda. We need the research, beyond doubt. It's not a formal evaluation agenda. To me, it's a knowledge management agenda going forward, not just about how we gather that information, how we distribute it, which has been mainstay in our work. It's about how we create connections between people who need to learn from each other, and enabling that interaction to happen, I think is going to be a very important part of what we do in the future. So I hope we can also focus on some of these key issues as we go forward.
Yes. In relation to that, Rashad, I've always reflected on that, thinking that the laboratories for clinical knowledge or biological-based knowledge are, of course, laboratories in universities. But where are the laboratories for the different type of knowledge that QI refers to on how to bridge the implementation gap? Those laboratories are our hospitals, our healthcare systems, our real care healthcare institutions. And the knowledge that is produced there is the knowledge that has to be shared. So that knowledge is not in books many times, it's not in universities. That knowledge is in the practice and in the experiences that are implemented and collected by healthcare providers, but local healthcare systems. So I agree with you. We need a strong way to link and to share this type of knowledge that is there, but it doesn't have really a strong mechanism to be shared among implementers.
The other part of this, I'm fascinated to hear you say this, because yes, these are the laboratories, the work that's going on right now, but these are living systems. They're not pure controlled settings. And how we learn from living systems is going to be of the essence. People are going on about their everyday work, and they're improving their everyday work. How we learn that isn't a matter of isolating the improvement work, but rather understanding it in the context and the messiness of everyday life that's happening. And I think, that's another thing that we need to be pointing out in the agenda for how we learn about living systems and how living systems can improve themselves.
I think that's exactly right, and seconding this, and also based on so much of what's come out here at the forum, we need to integrate the biomedical sciences with the social sciences in terms of understanding in depth what some of the processes are and the system implementation issues are, and I'm very hopeful that a lot of that will come out at the Salzburg meeting as we go forward.
But really, that is what is exciting about quality improvement work. It's about real people, it's about real communities. And increasingly going forward, I think the voice of the community is going to become very important. As we have learned this week, it's about what matters to the patient and not really what is the problem with them.
I agree. Just this morning we were having a conversation at breakfast, and one of the fascinating things that came up is that when we work on improvement at the community level, there are so many resources that are just untapped that become available to make improvements happen in ways beyond what we could have imagined can happen in facilities and things. And I think that's a great place for us to be sort of looking into for the future.
I do think the quality improvement methodology lends itself probably better than any of the other approaches to really including the community, and I think we are now moving away from our attention, I think, which has been focused mostly at the facility level, into the community now, and including the community in the kinds of structures that are changing the performance of healthcare. So I think it's really exciting. Some of the work that was presented this week at the conference is leading the way, and I think that developed or high-income economies probably have a lot to learn from a lot of that work that's going on.
I think the constraints that we have in low and middle income economies are the reason for the creativity that we see.
Yeah.
People have to get around them. They're actually used to getting around them. So they come up with things that are just, out of the expected, and that's what we can learn from. I think we should really recognize that and know that there's so much to be learned from what's happening in low and middle income economies.
We've seen this over and over again, both in Africa and in Asia, and I think particularly in the involvement of community and the sense of responsiveness to community and the connection back to the health system. And I'm sure that that's one of the major issues that will come up and be discussed, and hopefully that we'll be able to generate some mechanism to harness that information and spread it out going forward from Salzburg and bring some of these communities together.
If we were to sort of summarize what we'd love to accomplish during the next week, what would you say?
Oh, well, Rashad, I would particularly be very happy if next week has as one of its results a strengthened network of actors, of institutional actors, of groups, of agencies that are going to be present in Salzburg. A strengthened network of those actors that work together with better chances of producing good results, that have mechanisms to share and to interact and to strengthen each other. I think that I'm excited about next week because and I will contribute as much as I can to this result. I think that the work that Bruce is doing, that work that Pierre is doing, that work that Fives Alive is doing in different regions of the world is so interesting. When I talk to them, I can't wait for the next time we talk again. So if as a result of Salzburg we can develop a strengthened network of these actors and others, I think that will be very beneficial for our field, for QI in the world.
Yeah, for me, I would say that it would be the outcome, the desirable outcome would be to create a kind of platform that brings innovative solutions to the fore. And that creates also the platform for shared learning, not just among the lower and middle income countries, but between us and then the West as well.
For me, what I'm really looking forward to is the range of people who will be coming. And what I'm hoping is that we will be challenged to really think about the things that we haven't really thought about before, because the five of us are very deeply involved every day in our projects, and we've got a world view which I think could benefit from the different people who are coming to really challenge us about what's the best way to take this movement into the future.
I'm confident that there will be a fantastic exchange of information, and I think we're good at synthesis. I think we're good at synthesis of information, and we'll be able to put that together, and I think there'll be great exchange. But what I'm hoping is that Salzburg will really be a beginning. I think that all too often we find ourselves compiling and synthesizing and putting things together. But I hope that we're able to create a structure and a platform to keep this exchange going so that we can accelerate the learning and the implementation work even further as we collaborate and continue to collaborate with, in addition to all the people that will be there with us.
I agree. I cannot, agree more with what you've said, but I'd really look forward to a movement coming out of this, a movement that integrates the different actors. There are so many people who are working very hard at this. There are great results. I think to be able to bring people together, to create that exchange and that camaraderie amongst them, that they're all trying to accomplish the same thing. They learn from each other on an ongoing basis, in an informal basis. I think if we can create something like that, it would be good. And I hope that with that sort of network in place, what we can do is take improvement from the great accomplishments that we've had today to a whole new level, a level where we're really helping systems to become strong, capable of improving on a continual basis. Thank you.